Hi, I am Maureen Heberly. This is for medical terminology and documentation in Professor Saniuk's class. This is video pronunciation assignment number 2 for week 11. Number 1 is EOMI. That means episodes of mental illness. The sentence is, our patient will be chaperoned during the exam due to the history of EOMI. CAD is cardiac coronary artery disease. The sentence is, the buildup of cholesterol can lead to coronary heart disease, which is the leading cause of death in the United States in both men and women. PND is paroxysmal nocturnal dyspnea. Our patient cannot lay down supine for the exam because the PND history and the likelihood that being placed in the horizontal position may cause the patient to cough, wheeze, and struggle for breath. Number 4 is MRI, magnetic resonance imaging. MRI should be used in conjunction with other exams for women that have a high risk of developing breast cancer. TSH means thyroid stimulating hormone. Before our patients have an ultrasound guided biopsy of their thyroid, they must have lab work to measure their TSH level. Bradycardia means abnormally slow heart rate. While bradycardia can be normal during sleep, Martin Brady achieved the world record for the slowest heartbeat in a healthy human with a heart rate of only 27 beats per minute. I found that absolutely amazing. Trichomoniasis, I think. It's a parasitic infection of the genital and urinary tract, usually sexually transmitted. We usually call it trich. It is usually our female patients that come in and test positive for trichomoniasis, for which they must take metronidazole. Males rarely have symptoms, and 50% will naturally expel the parasite. Excuse me. Pyrogenic means production of fever caused by combustion or heat. My recent bout with strep throat led to pyrogenic results. Syndactylism means webbing of the fingers and or toes, and it is a birth defect. During fetal ultrasound exams, I look closely at the fingers and toes to rule out syndactylism. You know what I meant. Cholangiogram means radiographic image of the bile ducts. Even though I can image the bile ducts during an ultrasound exam, introduction of contrast on a cholangiogram can reveal more details in the area. Transillumination is transmission of light through the body for medical examination. A non-invasive way to view the chest or head of a small newborn is to use transillumination, although we rarely use it. Mammography means X-ray image of the breast using a device that compresses and flattens the breast. Anyone that has breast dense tissue will benefit from the more advanced digital mammography process. Catheterization means passage of a catheter into a body channel or cavity to permit passage of fluid. It is common for a patient to undergo catheterization when undergoing a lengthy surgery and recovery. Heterogeneous means not uniform in structure or composition. It has diverse ingredients. I am careful to look for heterogeneous structures during ultrasound exams, as this can be indicative of pathology. Septicemia means pathogenic organisms in the bloodstream or blood poisoning. It is frightening how quickly septicemia can take over and become fatal. Aberrant means deviating from the normal course. During ultrasound guided biopsies of the thyroid, I have seen aberrant thyroid tissue grow to an alarming size. Poliomyelitis means acute viral disease caused by the polio virus. It is an inflammation of the gray matter of the spinal cord. I am grateful to Jonas Salk, who was able to develop a vaccine against the devastating polio virus. Osteoporosis means porous or thinning bones, result of depletion of calcium and bone proteins. My grandmother was able to avoid osteoporosis by eating a healthy diet and staying physically fit. Hydrocephalus means abnormal buildup of cerebrospinal fluid in the ventricles of the brain. We also call it water on the brain or water head. During fetal ultrasound, I am careful to view the head and spine for any indications of hydrocephalus. Amniocentesis means removal of a small amount of amniotic fluid from the womb. We have several high-risk patients that have had an amniocentesis done to determine if there are any health issues with their fetus. This is for course HHS 255. Today is May 26, 2013, and again, my name is Maureen Heberly. Thank you.